Today here we have Dr. Dominik Schmelz from RISE, and he's going to talk to us about the TI Messenger and how they implement it.
Yes. Thank you very much. Yeah, after those 3 talks about security, encryption and naming, something a little bit lighter, more political, but also difficult to explain and difficult to find solutions. Today I'm going to talk about metrics in the sovereign health architectures, especially in Germany, but also about Austria and the world and in general. My name is Dominik Schmelz. I'm here instead of Professor Grechenig, who couldn't come today. A little bit about myself. I'm hired at RISE for 15 years now. I started off as a developer there, Python developer and C++. And nowadays I'm just doing product management or product development and project management. I myself have an engineering degree in software engineering, master's degree in business informatics, and wrote my doctorate at Professor Grechenig about distributed ledgers and data protection. So a little bit in this topic, and I have done a Masters of Law as well because I was bored afterwards. So I know about the technical stuff, about the legal stuff, and have been working in the medical system in Austria and in Germany now for the last 7-8 years. So for those of you who don't know who we are an Austrian company. We are a research and development company, a spin-off of the Technical University, where I did my doctorate as well, coincidental. And we are privately owned and have we have no shareholders, which is quite good if you want to do security solutions or designing things very well, building great stuff. What we did was sovereign systems for healthcare in Austria, in Switzerland, for really locking keys and payment systems and also airport systems. So you see, it's all about systems with many transactions, with high security data protection standards, but not limited to only healthcare, but in a broader sense, all about security and data protection. Yeah, our offices are in Berlin, Munich, Austria are, I don't know, one large one in Vienna, but also in the Alps. So if you want to visit us, it's pretty there. So to go further, as you have heard, I'm also a researcher, but I'm also employed at the university. RISE has a research department, not only a department, but a research company, and a company that creates products. The research company does a lot on universities, but also its own research, like departments for UI, UX, naming things, but also emotions with using apps and stuff like that. It's very interesting for me to see them, the philosophy around that. But also harder things like security. They won prizes for finding bugs 0 days in TLS, for example, and they are quite good. System engineering and so on. But also medical systems. So they are having a lecture at the Technical University as well for building medical systems. That's why we can think about things there, talk to students, talk to people about it, and then build those things hopefully right. So these discussions help, so it's swapping over. So usually those people that are thinking are also building. That's why I'm also holding lectures at university. And so do other people of RISE. So when we look at our modules or technical modules within the medical infrastructure, there are quite a few. So I'm just going to pick out a few that are important later to understand the sovereignty concept here. Sorry for that. So the most important is probably the EPA. I'm not sure if you heard about it the last days. It was a lot about TIM I saw in the talks. I couldn't attend. But the EPA is more or less a storage for electronic patient records in Germany, with the same thing exactly in Austria, called ELGA. I think different countries have different names for it. But there are the patient bills and other things stored not centrally, and that's the most important part about it, about the sovereignty, but decentralized. Not in a meaning like a blockchain, a decentralized system, but they are stored at the insurance. So each insurance has their own storage, and each insured person stores their information, or the doctors actually produce this information, store it with the insurance of this patient, which is interesting for the sovereignty of a system, because we are going to look at the sovereign definition later, which is one of those properties that are needed for that. And not just stored there at the insurance, where you might think, okay, that's a stupid idea because this insurance can look at the information, but it's stored in a confidential way and computed in a confidential way with a confidential computing system. I'm not going to say the German word for it, it's a long word, VAU in short. Another system, KIM, yeah, we have it down there, RISE KIM, is an end-to-end encrypted emailing system. Yeah? So doctors can, for example, send emails with structured information to insurances through our KIM and basic consumer, which is the encryption decryption device in a large infrastructure, are used with, in a week, I think, 5-6 million times to encrypt and decrypt emails there, because they send sick leave receipts over it, for example. So a sick leave, if you go to a doctor, he says, yeah, you're sick, and sends a sick leave receipt over it, and that is done via these systems. But also billing of doctors to insurances, those systems. And it's an email system, like an email system also on with SMTP and POP3 servers that are not centralized, like one system where they exchange information, but also in a decentralized way. The last system, which is important to understand it later, is, or technology more or less, is the identity system, because the identity system is not only an IDP with different interfaces, standardized interfaces, but also in a way that it can be deployed in a federated way. Yeah. It's the sectoral identity provider, which how the German system calls it, but in Austria it's just called the ID system, with different fractions in there that are using this identity system. Yeah. Nothing else here is, yeah, maybe the health data viewer, where information can be viewed, because later on we will see it's not only about messaging and the message itself, but it's also about information, about the data that is in it, especially in the health system. That is a very large discussion, how those systems can actually work together, and there it's important that this information is standardized, not only the data structure, but also the information which is in the data. Yeah, to understand the parts we are looking at within these systems, we need to define sovereignty. And I like this description of or definition from Fraunhofer, ISI, which says that it must provide, so a state or federation or whatever, must provide the technology it deems critical. So it's not about anything, it's about critical systems like the healthcare system, as we are talking about. And it must be able to develop these or source them. So they are not saying it must be developed themselves, yeah? But it must be able to be sourced. And it must be without one-sided structural dependency. The dependency part, as you might think, is the hard one, and the sourcing or developing themselves. It's not about a complete independent autark systems. It's not about building islands or something like that. This might sound like it, but it's not. But it's also not about everything. So not everything must be compatible and so on. And the dependency is only a one-sided dependency must be. So if it's a symbiosis between two systems that are working together, that might be okay, but a one-sided dependency is a bad thing for sovereignty. We see that probably nowadays in politics very, very well. So if we split it up into layers, so we can talk about those different layers and where Matrix and Tim are influencing these layers. We have to look at, let's start at the bottom, the hardware layer. Obviously, we are dependent on hardware, even if you're deploying it in an infrastructure somewhere. On the client side and on the server side. And nowadays, we are quite dependent. The semiconductor production is mostly done somewhere else, only 10% in Europe. We do provide things for semiconductor production, but we don't do it ourselves. The infrastructure, same, different. Obviously, everybody knows that European cloud systems, data centers, most of them where things are deployed are in American hands nowadays. So we need infrastructure with European cloud environments or European data centers. And on the software side, on the top, standardization, multiple vendors. Obviously, it's very bad if there is only one a vendor of it, even if you have it standardized. Thinking of systems that were standardized or opened, like DocX or something like that, which is not implemented correctly by anybody. That's why it's also important that we're waiting for the 2.0 specification so everybody can implement it. But it's important to understand that the software stack on the client side, operating system side, and on other sides, like the application itself, the client is accessible and can be used for this sovereign system. So what does it mean? I said, okay, that can be used. Well, there are properties. And those properties can be held against those solutions because then you can see whether they can be used in a sovereign system. So obviously, the most obvious one is exchangeability. If it's not exchangeable or interoperable, at least, then you can't. Then you rely on it in a very bad way. You have to be able to certify it. Yeah? Does not necessarily mean that you have to be able to look into it, but you have to be able to certify it from without opening it, hacking it, or something like that. It must be composable with other systems. Yes, a little bit like interoperability, but a little bit different because then they need to be modular and must be substitutable and stuff like that. And it must be governable. So it must be that you can do updates, you have the identity management for it, the traceability, and so on. And last but not least, the resilience. So systems that are not resilient against attacks or can be built in a resilient way are obviously bad for self-sovereign or sovereign systems. When we look back at the thing that I said is most important, the basis of this all, from the point of view of the patients, is the EPA platform. As I said, there's where the health records are stored. It's modular in design. It's on multiple devices, so the insured person in Germany can access it from multiple mobile devices, notebooks, and so on. It uses standards. Yeah, like FHIR, might know this standard from HL7 group. No. Yes, probably. And it's approved by the German Gematik, an institution that approves it, and also a security approval by an external auditor who has to comply with the BSI standards. Yeah, and last but not least, on the right side, yeah, it has medical applications in it. It's extensible. You don't only have this access to files and then you see it, but you can have multiple applications in it. It is you can administer it. You have this identity in it, in the means of the identity management of the identity providers around it, and it's used in a way already with several insurances, private insurances, and statutory insurances. So, but let's look inside. There are two flavors of TIM. Now getting into TIM, why we are here. One is the one that is for the insured person, TIM EPA, which is usually a mobile client, which is included within the insurance app. So each of them has the possibility to use this TI messenger and therefore the metrics system. That's around, with us, 25 million insured persons that already have that app with this messenger in it nowadays already. And the second one is TIM Pro, with this for healthcare professionals. Yeah, so doctors, hospitals, and so on. And those usually use it connected within their actual systems in it. They are not using it on a mobile or walking around, and maybe they will do it when they are somewhere else, but usually they use it within their system. Let's get a little bit more technical. So if we look at it from an architecture standpoint, we have again 3 layers and this composition of different systems. We have, let's start at the bottom again, the identification and authentication. So this onboarding process with the German identifications of, for example, doctors, as we had it before, the ID cards of doctors from the last talk, then the doctor might use his card to write an end-to-end encrypted email or receive an end-to-end encrypted email, and can therefore use this verification step that he can decrypt this email as a verification step for the onboarding. And also the identity providers are used, sectoral identity providers are used for the insured persons. So from each insurance, a different identity provider, which are used in the app. And as you can see on the top, the app, the EPA app, which is already rolled out, has a module in it there for those messenger clients. So it's TIM EPA user client, because also there is an administrator client, as you see at the top. And besides the RISE EPA app, you can see the RISE TIM Pro user client. So for the health care professionals that are using them in their practices. And to the right, you see the systems. And the systems, obviously, there's a messaging system for doing the TI messaging with the metrics home server included in it. And it can also use this end-to-end encrypted system. Obviously, it must send these emails out with a token in it so they can be verified. And on the top and in the center, you see a central identity provider by Gematik and a directory. A directory where all those that are reachable in the system can be found. And it can be accessed as well, who is allowed to contact whom in there. And last but not least, the administration part on the top, where a doctor or the practice can change who is seeing what, can see notifications of messages that were sent in there, and so on. He can administer the system. Well, in summary, that's the EPA user client on the left, the pro user client, the org admin client, and soon enough another client that can be included as well for other systems in other apps, and for integrating into other third-party systems at doctors' offices and headless version of it. As I've said, the interaction is quite much. You see the patient in the middle. Patients are not allowed to contact patients in here, but the interaction is between pharmacies, general practitioners, specialists, the healthcare insurance as well, ambulatory facilities and hospitals. And all of those can communicate within the system, which is, as you might think about probably your health journey, very helpful usually. So how does it look now for the sovereignty part? At the data center part, as we can see at the top, the confidential computing solution for healthcare applications is the solution there, that you have an own data center or you use another data center, but you have a confidential computing solution in there. We, for example, have data centers in Germany with such a confidential computing infrastructure in there. Specifications, approved, audible components. Well, the infrastructure and operations are specified and approved and so on, so that these components fit together. And also the development process of software is approved, which is quite a lot. So we have this certified infrastructure, the secure coding process, and each product needs to be certified by the institution Gematik. And it enables a federated provider-independent communication. So all those clients that I talked about, we're not the only provider of those, but there are several ones. Some of them are also here today, can interact with each other. Also, the identity providers can be exchanged. I said the sectoral identity provider, we are one of them, but there are several other providers of sectoral identity providers. And we are only implementing the specified features. I've heard and seen things that are implemented within these clients, which is cool where if you have extra features in it, but they are not compatible with other clients, which is obviously bad for sovereign systems because it's not inter-exchangeable anymore. So to summarize it, before we can go into the questions with one graphic, we have those sovereignty properties, the exchangeability, interoperability, certifiability, composability, governability, and resilience. And when we look at the system from a broad perspective, then we see external applications that need to communicate with the system, that need to include those clients. Those need to be exchangeable and interoperable. They need to be certified, and it needs to be composable with those clients. Yeah? It needs to be governable and resilient here as well. Also the client, the messages within the client need to have those properties. The data within it. I've said the FHIR standard, HL7 standard, is one of those. To exchange real information about appointments, about diseases and stuff like that. That needs to be specified and governed as well. But also the infrastructure, as I said, the messaging services to each other. Yeah, the messaging services to each other, but also to external systems. And the external services, last but not least, need to be compatible with those messaging systems. So I'm coming to the end of my talk. If you have any questions, discussions, you can ask them now or outside then with a beer in your hand.
Any questions? We can also ask them in chat. I can also already make a service announcement in case there are no questions. There will be a bar afterwards in the opposite room in the other building. We will have multiple sorts of cocktails that you can pick from. And other questions? Seems like there are none. Yeah, everyone's waiting for cocktails.
Exactly.
I can see. Okay, there are no questions. Thank you very much for your talk.
Thank you.
Please give it up for Dr. Daniel Schmelz.